Hi, everyone. Welcome back. I'm Dr. Samantha, the maternity mentor, and we're here for another one of our live Q&A sessions that we have on Mondays at 9 p.m. Eastern Standard Time. This is your chance to answer any questions that you have for me live, so please feel free to put those into the chat. This is also my chance to answer any questions that you guys may have submitted on the videos. Please remember to like and subscribe to the channel. Subscribing to the channel really helps me out as a content creator and allows me to be here to talk with you guys. Also, remember we're on Facebook and Instagram for additional content. And please remember to share the channel. Share the channel with friends and family and tell them to like and subscribe as well. This allows me, again, to keep being here on Mondays to answer your questions live. So I'm going to jump right into questions because we were not here last week. And so I have a lot of questions tonight, but please feel free to put any of your questions into the chat. So I'm going to start out with a question that I had on my blood pressure medication video. And what it said was, can I take blood pressure medication while I am pregnant? And so I think this is a great question to start out with. So blood pressure, high blood pressure is a very complicated issue for pregnant people. High blood pressure can complicate your pregnancy and lead to a lot of different issues, including the possibility of developing preeclampsia. And preeclampsia is a medical emergency that we have to deal with, and it often requires us to do early delivery of your baby. So we really take high blood pressure seriously. Now, there are many high blood pressure medications that are safe for pregnancy. There's a lot of them out there that are safe for pregnancy. A couple that are commonly used include labetalol, which is a beta blocker, and Procardia, which is actually a blood pressure medication that is also used to help treat preterm contractions. So those are two great examples of medications that can be used. Now, just like those are great medications that potentially can be used, there's a whole bunch of medications that cannot be used during pregnancy. As a lactation consultant, one of my jobs was to actually consult with providers on different medications that were safe for breastfeeding women. And of course, now in my line of work, it's also to talk with different physicians about medications for blood pressure for pregnant women. So the biggest thing is if you already have pre-existing high blood pressure, you want to go ahead and get preconception counseling. So preconception counseling is where you speak with your OB and potentially a maternal fetal medicine specialist. These are the high-risk doctors that help to take care of women with complications. And you want to go ahead and speak to them ahead of time and ask them what your options are. What are the safest things for you to take while you're pregnant for your high blood pressure? And then based off of those recommendations, you might need to change your medications so that you are ready to go with that. But the short answer is yes, there's lots of medications that can be used for high blood pressure, but it does require a conversation between you and your healthcare provider. So I got a whole bunch of different questions, which is awesome. So I got a question on my carpal tunnel video, and it said, what's the best and safest pain relief option during pregnancy? So carpal tunnel syndrome. Carpal tunnel syndrome is extremely common during pregnancy. So this is the carpal space. It's a space in your wrist, in between your arm and your hands. And when you have carpal tunnel syndrome, what happens is that this space gets compressed and you end up with pain and a tingly type of feeling up in your hands. It's very common for people to get who work at a computer all the time because of wrist positioning. For pregnant women, part of the reason or part of the thing that happens is that this space can get compressed by swelling. Okay. Swelling is unfortunately very common during pregnancy. And so if you already have pre-existing carpal tunnel or you were predisposed to getting it and or you get swelling, that can lead to this. And the carpal tunnel can be really, really bad, like really painful. In fact, it can keep people up at night and all sorts of other things. So what can you use for pain? That's complicated, right? So when we're pregnant, there are tons of medications that are safe and there are other medications that are not so safe. So sorry, guys, I think I might be getting sick. So sorry if I act funny or if I sneeze. So some of the things that you can take. Tylenol is safe for pregnancy. Most women are told that right away, and that's very important for you guys to understand because that's an option for you to use. So Tylenol is something that could be taken. Now, in this case, musculoskeletal, very often we recommend ice. Okay, ice is very safe for most people to use as much as they want whenever they want. However, if you use ice, it is very important for you to cover the skin with a piece of cloth. Doesn't need to be very thick, but it does need to be enough that it gives your skin some protection. What a lot of people don't realize is you can actually burn your skin with ice. And I know it seems counterintuitive, but it's actually a real thing. Now, you can ice. When you ice, you can ice for like 10 minutes before taking it off. Another common thing to do is to use braces. So there are different braces that will help to eliminate some of the compression on this, and then that can help with the pain. Bracing at night when you sleep is especially helpful. I also recommend women go to a hand specialist, specifically a carpal tunnel hand specialist, which is usually a hand surgeon. Ultimately, the final treatment for carpal tunnel, if it's left unresolved, is surgery. But these specialists, first of all, know the best braces. Second of all, they can refer you to physical therapy or occupational therapy to try to help with some exercises. But finally, you establish care. So carpal tunnel postpartum can be extremely debilitating. Think about it. If you're in excruciating pain and you have to try to hold a baby for breastfeeding or bottle feeding, look at this position. This can be extremely painful. So it can be hard to change diapers, everything. So by getting established with a carpal tunnel specialist, if you do decide that you want to have surgery, you're already an established patient and they can get going on that almost immediately postpartum. And the carpal tunnel surgery is super easy. So it can be done and you can still effectively take care of your baby because usually they just come into the space and they clip the little muscle that's here that's causing the compression. So it's a pretty easy surgery. All right, so I had a question on my breast milk storage. I have some videos that I've created on breast milk storage, on water for formula, on how to clean bottles and pacifiers. So on the breast milk storage, it said, when I take breast milk out of the refrigerator, does it need to be served cold? This is an awesome question. So the answer is, when you take breast milk out of the refrigerator, no, it does not need to be served cold. The best way to warm it up is actually to leave it out on the counter for an hour or two to let it get to room temperature. Okay. But let me just be clear. I encourage you guys to give cold breast milk. One of the things that I think is a waste of money, and I'm pretty sure it's on my video that I created on waste of money products, but is bottle warmers. The biggest thing that really can cause you to have a very particular baby, and a baby that makes it hard for you to go out and live your best life, your normal life, like, is a kid who's not adaptable. And some of the products out there that seem like so awesome in theory are actually not that great because they create a baby who's not very adaptable. A couple examples are baby wipes warmers and bottle warmers. If your baby is only used to warm breast milk that has to be warmed up, it's going to be very hard for you to do that on the go because your breast milk needs to stay in a cooler if you're going to be out for a couple hours. A wipe warmer, like, you can't take a wipe warmer to the park. So then what happens when you need to use cold wipes? And those are a couple examples of many things that are out there. I personally think that letting the baby kind of be on their own schedule to a certain extent, to have a lot of noise and light around them during the day, all these things are actually really helpful to creating a kid who can kind of go on the fly and go around and do what it needs to do. So as far as breast milk goes, there is no requirement for you to warm it up. It can be served cold. Just remember, you cannot microwave breast milk. If you microwave breast milk, it can actually kill good stuff in breast milk, and it can also create hot spots. So then you have to make sure you are mixing it up really well, or it could actually harm the baby. Now, the one exception to warming milk, anybody who has a baby that is born prematurely, okay? And these are babies, the babies that I'm usually talking about are babies that are usually under 36 weeks. A lot of these babies do need to have their milk warmed up. Okay, these are babies that are born medically fragile and they need a little bit of extra TLC, and having milk that is warm is a little bit easier for them to manage versus cold milk. But even them, as they get to be older, they don't need it either. So, okay, let's see. I have tons of questions tonight, guys. You guys sent me good questions. Okay. I'm in my first trimester and I have been diagnosed with hepatic steatosis. What do you recommend? So this one came on my cholestasis video. Cholestasis is a liver condition that is very common during pregnancy. So hepatic steatosis is actually not a very common surgery. It's also called fatty liver disease. And fatty liver disease on its own is usually treated with like diet and exercise and stuff like that. However, if you were to develop something called acute fatty liver disease, which is also sometimes called hepatic steatosis, this is actually considered a life-threatening emergency. And most often it requires delivery of the baby. So this is something that is very challenging to answer this question because, of course, in a first trimester, you wouldn't want to deliver a baby. The baby is not viable. So what I would recommend is that if you are not in the acute stage, you would want to go to a maternal fetal medicine physician to let them look at your liver function tests and kind of determine the next steps to your care. Because if it's just fatty liver, they may like approach it with like a diet-based type of treatment. They may also be looking to see if you have hepatitis. Hepatitis could complicate everything. So that's why you definitely want to go ahead and like get seen by a maternal fetal medicine physician. All right. For those of you who are joining, please feel free to put your questions into the chat. I'm going to go ahead and answer, I think I had 2 questions on bleeding this week. I didn't have a lot of them. So one of the questions was, my wife is 9 weeks pregnant with twins through IVF. She's experiencing minor bleeding again after a good doctor's visit last week. Is this normal? The ultrasound last week showed good heartbeats. Now, before I answer that question, I had something sort of similar. And that was, it was on my Cerclage video, and it said, it's been 4 weeks since my Cerclage. I'm experiencing brown vaginal discharge with no contractions. Is this normal? Okay, I put these 2 questions together for a couple reasons. So for starters, brown discharge is usually a sign of old blood. This is blood that was active and is now resolved. And so that's something that is a pretty good sign. I mean, we're glad if it's an old, but we still want to report it. And I noticed that they said I'm 4 weeks after a cerclage. Listen, guys, if you have any bleeding in your pregnancy and it seems to resolve, and let's say a couple days later you're seeing something again, you need to look at that as a new bleed. And I think this person with a cerclage mentioned that it was 4 weeks after cerclage because it's very common with a cerclage that you're actually going to have some bleeding. So a cerclage, for those of you who don't know, you've got a cervix, right? So an incompetent cervix means a cervix that starts to dilate on its own. So cerclage is simply a surgical stitch that stitches this cervix closed. And then when you're about 38 weeks, we go ahead and snip that stitch so that the cervix can dilate on its own. And so when you have this, I mean, imagine your cervix looks kind of like this: long, thick, closed. Okay. But it's still like a soft piece of tissue. It actually kind of feels like your fingers. And so when we're stitching this, we're going to put a needle through some flesh, and that can cause a little bit of spotting. So I'm sure that's why this person was kind of saying like that they were 4 weeks after and seeing some brown spotting. I would not assume that brown spotting has anything to do with their cerclage. Now, let's say it does. Samantha, how does it relate to the cerclage? One of the things with a cerclage is that you've put in a cerclage because the doctor feels that like you're at risk for preterm labor and dilation of your cervix. Well, some people their body will basically fight the cerclage, okay? So what happens is they keep having contractions, either silent or active. And when you have a contraction, what happens is the body's trying to do this. This is your cervix, and your cervix is eventually going to do this. So this is effacement and dilation. And so when you have those contractions, it kind of does this, which is shortening the cervix up. So if your body's still actively contracting, it can fight this stitch that we've put in place. It can actually cause some bleeding. So that little bit of brown blood could be related to the cerclage, but for an entirely different reason. Now, for our twin pregnancy, right? So the patient said that they were experiencing some minor bleeding after a good doctor's visit. So you could have a good doctor's visit this morning, and this afternoon, you could have some kind of complication. And it doesn't mean that some major event happened. It's just things happen. So if you guys see bleeding, the number one thing is to call your healthcare provider or go to the hospital. That's what they're there for. And the thing is, they're going to want to do probably most likely another ultrasound. I have a video on the things that you should expect if you go to the hospital and you're bleeding, but there's a lot of different tests that we might run. But ultimately, the number one thing we can do to try to figure out what's going on with bleeding is to do an, depending on what's going on, depends on what your treatment might be. So if you have a placenta issue, like a placenta previa, which is where your placenta is completely over the cervix, well, that might be treated with bed rest, whereas a subchorionic hemorrhage, which is a little pool of blood underneath the placenta, that might just be something that we watch and wait and see and do repeated ultrasounds. So it's really, really important for you guys to contact us so we can decide how we are going to assess you on that. Okay. So the next thing I'm going to answer is some questions on antibiotics. And remember, guys, if you guys have any questions, please feel free to put them into the chat. So I'm 27 weeks pregnant, and my doctor prescribed clindamycin, 300 milligrams, one pill every 8 hours for 7 days. Is this medication safe? The next one said, I didn't know I was pregnant for the first 4 weeks. My doctor prescribed clarithromycin antibiotics once daily for 7 days. Could this baby? So these are two great questions to start out. And I actually have a couple other questions related to antibiotics. So antibiotics only treat bacterial infections. Let's just be clear. So if you guys are getting sick with a cold, that's not going to usually treat that, because a cold is usually just a virus. And viruses only respond to antivirals. And antivirals are extremely rough medication and only given to anybody on a very limited basis. And your average cold really doesn't respond to antivirals. So when you're talking about bacterial infections, then we talk about antibiotics. Now, it's very important for you guys to take all of the antibiotic as prescribed, because we have a lot of antibiotic resistance in the world. And antibiotic resistance is becoming an extremely serious, life-threatening issue. The problem is that because these bacteria are growing defenses, the antibiotics that we have now don't work as well. The biggest reason why we have this is overuse of antibiotics, as well as inappropriate use. Now, inappropriate use can be one of two things. It can be one, prescribing an antibiotic when you have a virus, or two, not taking the antibiotic as prescribed. Antibiotics are awesome because in a day or two, you start to feel better. So it's very tempting to not take all of it, especially when you're pregnant, because you feel like, oh my God, I don't want to put something in my body. But if these medications are safe and being prescribed to you, you need to take it to completion, because a bacterial infection is a high risk for causing a miscarriage, preterm birth, or even a stillbirth. So that's why it's so essential. Now, if you were to not take the antibiotic to completion, in a couple of days, you'll start to feel better, right? But all the other bacteria in your body, they're going to build up a defense to the antibiotic we gave you, and then you'll start to feel worse again. But now when you restart the medication, it won't be as effective. And so that's why it's so important. The other thing, guys, is that I don't know if you heard me say, but we overuse a lot of different things. So one of the things that we overuse a lot of is antibacterial cleaners and antibacterial soaps. So for many years now, my family really hasn't used any of the hand sanitizers. We don't really use antibacterial products or antibacterial soaps. We did long time ago, before I knew a lot, honestly, about antibacterial resistance. We restarted using some of it during COVID because none of us knew for sure what we were dealing with. But other than that, generally speaking, we don't use it because it's not safe or healthy for us. We're designed to be exposed to all these little microorganisms in our environment and then be able to create immunities for them. About a year after COVID, when, basically the whole world spent about a year in some kind of lockdown, right? We were either in a voluntary kind of lockdown or a involuntary lockdown. And many of us spent a lot of time at home and we really didn't venture out because none of us knew for sure what COVID was or how it worked. Well, at the end of that year, a new illness emerged. It was very rampant in Europe and it was extremely deadly. And it was not COVID. And for about 6 months, it was extremely scary because it seemed like there was another illness, another scary pandemic basically going around. And everybody was testing for COVID. They were testing for the flu. They were testing for RSV. And it wasn't any of these things. And so they tried to figure out what it was. And what it was the common cold. It was just a regular old common cold virus. But the reason why it was so deadly the year after COVID is that we had spent so much time not being exposed to germs that our immune systems as a whole had weakened. And so that's why it's so important that you do allow yourself to be exposed. And now I'm not encouraging pregnant women to be exposed. Let me just be clear, because you are considered immunocompromised. Your immune system has to tamp down in order for it to not attack the baby. The baby's considered a foreign body, right? So your immune system is calmer during pregnancy. And that's why pregnant women are more prone to very serious illness, especially when it comes to like COVID or the flu and stuff like that. But when you're not pregnant, being exposed to things, not being so worried about germs, is actually better for you. Now, as far as clindamycin is safe for pregnancy. It's used very commonly. It's a great antibiotic. Clarithromycin is not used as often, okay? It's definitely something that's kind of a risk versus benefit. But as of right now, there's no data to indicate that clarithromycin is something that we need to worry about, okay? So both of these really can be used quite safely. Now, we had another one on the urinary tract infection video, and it said, my wife is experiencing back pain that feels like labor, but she's still 2 months away from her due date. She was prescribed Cefixime, but it hasn't helped. What can we do? So I love talking about urinary tract infections because they are probably the most common infection that we will see. And it is one of the most serious. I can't tell you how many women I have watched give birth prematurely because they had a urinary tract infection. I can't tell you how many women that unfortunately I helped them through their miscarriage due to urinary tract infection. So please be aware that urinary tract infections are a very serious thing during pregnancy. So why do we get urinary tract infections to begin with? So you have your bladder, okay? And the bladder has at the bottom a urethra. Urethra is a very small tube that goes from your bladder outside. So the urethra is just above your vagina and just below your clitoris. And that's the little hole that the pee comes out of, right? Now, the reason why we tell women to wipe from front to back, so that's from clitoris to vagina, is because when you wipe from clitoris to vagina, you're basically going from clean to dirty, okay? Because down here below the vagina is your anus. That's where poop comes out, right? Well, there's a lot of bacteria in stool. And so if you wipe from back to front, you can potentially put bacteria right over the urethra. And that urethra is short. So it's really easy for that bacteria to go and into the bladder, okay? Now the bladder is dark and it's moist and it's the perfect environment for bacteria to grow. So how do we prevent a urinary tract infection? Well, normally there's two big things: drinking a lot so that you pee a lot. And then second to that is, drinking a lot and peeing a lot. Sorry. So that's usually what helps to prevent a urinary tract infection. But when you are pregnant, you got this big old baby and uterus that's leaning on this bladder. And sometimes, even though you think you're emptying your bladder a little bit, your bladder can basically be kind of tilted. And so here is your ureter, right? Sorry, urethra. And there's a whole bunch of like urine that just sits here because it can't get out due to its angle. And so that urine that stays behind can grow bacteria. And then you get this urinary tract infection. Now, outside of the bladder, you have two ureters. And the ureters are small tubes that lead into the kidneys. Okay? Your kidneys are an extremely important organ. They're one of the main filters of toxins out of your body. Now, the thing is, they're full of blood. The kidneys are very blood rich because they're filtering toxins out of your blood, right? So if you have this urinary tract infection that goes up the ureters and into the kidneys, well, then you end up potentially with a blood infection called sepsis. And sepsis is life-threatening to both you and the baby. And this is where we have that common cause of miscarriage, and or we have a baby that we have to deliver early because it's a medical emergency for both you and the baby. So we want to avoid getting the kidney infection, which is also called pyelonephritis, by treating urinary tract infection. So what can you do? Take your antibiotic, drink lots of fluids, pee a lot, okay? Now, you may read online that there are a whole bunch of homeopathic treatments for urinary tract infections. I'm very homeopathic, guys. I utilize vitamins and alternative medicine in my in my daily practice all the time. I am very pro vitamin, very pro diet, very pro alternative methods. But it makes me really angry when pregnant women see these stories and they think they can treat their urinary tract infections with something like an antibiotic or something. With something other than an antibiotic. So one of the most common things you'll see is cranberry juice. Cranberry juice being something that can treat a urinary tract infection. It cannot treat a urinary tract infection. Now, to be clear, cranberry juice can be an excellent way to prevent urinary tract infections. And if you are pregnant and you are not diabetic, I absolutely encourage you to drink real cranberry juice. So let me explain. Cranberry juice is effective because it makes the urine more acidic. And by making the urine more acidic, it discourages the growth of bacteria. Okay, so that's how it truly works. Now, there are some properties of cranberry that also seem to just be a little bit more effective, but ultimately that's what it's doing. It's not an antibiotic. It does not truly kill bacteria, but it certainly makes the environment less comfortable for them. Now, why did I say diabetes? Cranberry juice has sugar in it. So if you have diabetes, this is not a good idea for you. But other than that, I mean, cranberry juice is great, especially if you drink real cranberry juice and then you're drinking fluids, which is what I just told you guys to do. What is real cranberry juice? It is not ocean spray for any of you who are in the United States. Cranberry juice is the real deal, usually in a glass bottle. It is not that bright pink, rosy stuff that you see. Nope, that's fake. It is usually a much darker red. It can sometimes even have a brownish hue to it, and it is very bitter and disgusting. However, it is really, truly the healthiest for you if you're going to drink cranberry juice. Now, second to that, okay, it would be, we hear about D-mannose. So D-mannose is oftentimes recommended because it can help to treat urinary tract infections. Again, D-mannose does not treat urinary tract infections. D-mannose does help to basically prevent the bacteria from sticking to the walls of the bladder. And if it can't stick to the wall of the bladder, then it can't sit there and then potentially grow. So D-mannose is another one that you hear about. Now, D-mannose, what I am going to say to you about D-mannose is this. This is an over-the-counter supplement. So unfortunately, a lot of supplements are not recommended for pregnant women because they are not studied or regulated in pregnant women. So it's very unclear if the ingredients are actually safe for use. You're going to see a lot of these ingredients all over in a lot of different supplements. I try to encourage people that if you see some of the basic vitamins, magnesium, vitamin D, oh my gosh, vitamin C. These things have been around forever, right? And so these things are usually safe. Now, you also have some supplements that are based off of food. So we just talked about cranberry juice. I have seen stuff with basil or lemon, like different things like that. So I'm going to encourage you that if you see some of those treatments, don't grab the supplement. Don't grab that pill you see on the counter. Instead, utilize those directly out of your diet. Garlic's another good one. Utilize it out of the foods that you're eating. First of all, we're meant to get our nutrients from our stomachs and our intestines. That's how human beings were meant to get that stuff. But second of all, when you're grabbing garlic, fresh garlic that you're crushing and peeling yourself, you know what's there. You know what's in it. In those pills and capsules, yes, there is some, we'll use the example, garlic in it, but it's also made in a factory. There's a belt that stuff's coming down. There could have been before that black cohosh, let's say. Black cohosh, just so you guys know, is not safe for pregnancy. And so there could be a cross-contamination. There's fillers in that stuff. Those fillers are not regulated. So you want to be careful with some of that stuff before you use it. And D-mannose being a supplement, there's really no need to use it during pregnancy because it's not going to prevent enough of a risk. It's not going to be enough of a prevention tool to incur the risk of it. So, hi, Burn Peel. So, my friend is 6 weeks pregnant with her second. First baby turned 1 in October. She said her OB said they will have to take the baby at 38 weeks. I told her to ask her OB for the reasons. Yeah, so I have zero idea why they would say that. Now, the one thing I will say, well, actually, I'm thinking about this. She was going to be almost a year post. Yeah, I don't know why they would say that they need to take the baby early. It could be due to complications from her pregnancy that they're concerned about it. I mean, my guess is the only reason why I really hear OB-GYN say they're going to take a baby at 38 weeks is due to complications, previous complications. So that could be gestational diabetes or hypertension or an emergency C-section or something like that. Now, what I will say, guys, is this is a very funny thing. This OB said 38 weeks, and that's very interesting. So all of the guidelines now say to not deliver a baby before 39 weeks. If your baby is born before 39 weeks, to be very clear, your baby is preterm. I know it used to be back in the day that everybody thought 39 weeks was full term, ready to go. And so a 38-week baby was also full term, and it's really not. 39 to 40 weeks is considered full term. A 38-weeker is like on that cusp, and 37-weekers are actually classified as late preterm babies. And as a late preterm baby, these babies actually have issues with temperature control, with sugar control, and they have issues feeding. And that's because there's brain development that still is happening between 37 and 40 weeks. Now, understand that brain development will happen outside of your belly, but they still have to have that brain development happen. Okay. So that's why these kids are considered preterm. Now, the OB says 38. A lot of women, when they get to the end of their pregnancy, they're exhausted. By 36, 37 weeks, you feel big, you feel large, you're achy, you might have been sick for weeks. You're ready to have the baby. And so a lot of women and their families start to get very antsy about meeting the baby. And we still have this mindset that 37, 38 weeks is okay, right? So a lot of OB-GYNs will say they're going to induce at 38 weeks, right? And they do that, I think, partially as like a customer service thing. Like if I say 38 weeks, she's going to feel a little bit better about this, right? Especially when she's big and pregnant. Right now, she's 6 weeks pregnant. So she's probably questioning everything. But when she's at the 36-week mark, knowing it's going to be 38 weeks versus 39 sounds amazing. But 9 times out of 10, when they say 38 weeks, they're actually going to induce at 38 weeks, 6 days. Because really what happens is they have you come in that night at around midnight, or they have you come in maybe at like 8 o'clock on the 38th week, 6th day. And then after midnight, when you technically are 39 weeks, they start the induction. So it's very possible that they're actually not going to induce early. They're going to induce on that 39th week. But then why? It's probably related to some complication. Hi, Michael Jordan. So your wife is 10 weeks. She thought she was having a miscarriage. The doctor said the cervix was closed, but the baby was lower in the uterus, but that there was bleeding and he couldn't say whether it was coming from, if it was good or bad. Last year, she miscarried at 13 weeks, an incompetent cervix. First appointment is Wednesday. What questions should we ask? Okay, so this is really, really, really important. So it sounds like, Michael Jordan, that your wife has a history of an incompetent cervix, which means that it's very possible that she's going to experience another incompetent cervix. Unfortunately, we always there's always an increased risk once that's happened once. And so again, the bleeding could be coming because like she is starting to contract and the cervix is fighting dilation, but that's what's causing it. What I will tell you is the first thing you want to ask about is a cerclage. Hands down, 100%. A cerclage, again, is that surgical stitch that helps to close it. There's actually 2 kinds of cerclages. I don't know the full official terms, so please, guys, like I know more of the layman's terms, but basically there's like the standard cerclage, which is just around the cervix, and then there is one that's called an abdominal cerclage. So the abdominal cerclage is basically like a standard where it ties around, but then there's a stitch that goes up into the belly, kind of underneath the belly button. Okay. The abdominal cerclage, and I have a cerclage video and I go into this a little bit. The abdominal cerclage is actually more effective. A lot of people don't know this. It's actually a little bit more effective and it is slightly tiny bit safer, right? But if you have an abdominal cerclage, you must have a C-section. So this is why we don't hear about it a lot. It is a 100% absolute must have a C-section. And so they don't do it a lot unless there's a high risk of recurrent incompetent cervix. But that's one thing to ask about is your potential options. Now, I feel like I'm going to sneeze, guys. Sorry. So the next thing I would tell you, Michael Jordan, is to ask about bed rest. So I do have a video on bed rest. Now understand, bed rest should not just be done. That is something that you all need to know. There's a lot of risks with bed rest, and bed rest isn't as effective as people think it is for preterm labor. However, with a baby that's sitting very low, if a uterus is sitting very low and it's putting a lot of pressure on that cervix, sometimes bed rest is a good idea, even like a short-term bed rest, because then you're taking the weight of that uterus off of the cervix. Because right now there's a uterus like sitting right there. And if you're on bed rest, you see how that weight goes, right? So this is full weight, this is less weight. Now, that bed rest is not just like I'm laying in bed all day. That's actually not what it is all the time. Bed rest could be something like this. It could be, oh, you work as a waitress? Okay, well, you can't work as a waitress anymore, but you can do everything else in your life as long as you're taking a lot of breaks. That's actually one form of bed rest. It's kind of more like you need to take it easy and put your feet up a lot, but yes, you can do things in moderation. Other forms of bed rest include complete bed rest. You can't take a shower. You can't get up to go to the bathroom. You can't do anything. Everybody's doing everything for you. So it's kind of just one of those things that you've got to figure out what they mean. Michael Jordan, I would definitely ask about sex, but my guess is no sex, and that's very important to ask. But guys, I do have a video on pelvic rest. If you guys are ever being recommended to have no sex or nothing in the vagina, you want to make sure you ask if orgasm is included, because a lot of people will try to maintain that intimacy through like mutual masturbation or something like that. And a lot of times you can't have an orgasm if you are on pelvic rest. Other things that you might want to, you might want to make sure of is like, what are their thoughts as far as liquids? She probably needs to be drinking a lot of fluid to prevent contractions from dehydration, and how often you're going to see the maternal fetal medicine physician. Okay. So definitely keep me updated and let me know if you have any other questions. Please let me know. Cefixime, if I didn't say that, because that was the end of the UTI thing, is safe for use. Now, I also had a question on the yeast infection video. Yeast infections are another major cause of preterm labor. And it said, I'm 25 weeks pregnant and my OB-GYN prescribed metronidazole and miconazole nitrate. Are these safe medications for the baby? Metronidazole gets this really bad rap on Google. Dr. Google does not have a college degree, guys. Okay. Dr. Google is not your friend. Dr. Google gives very bad advice. So please do not go to Dr. Google. And Dr. Google loves to say that metronidazole is not for pregnancy. Metronidazole is used all of the time during pregnancy. Okay, we use it. It's a very effective treatment for a couple different infections that can have catastrophic effects on your pregnancy if they're untreated. Metronidazole is being used at very safe doses when we give it during pregnancy. We're not giving it these massive doses that might cause issues. So metronidazole is safe. Now, miconazole. Miconazole is an anti-yeast infection treatment. It is found over the counter very regularly. You can also get prescription. And miconazole is very tricky. It's very tricky in general with the yeast infection because you see these treatments on the shelf and you just think to yourself, I must be able to use this. Never use any yeast infection treatment without talking to your healthcare provider. For starters, there are different ways to administer the medication, right? So a lot of them are suppositories or creams. Depending on what's going on with your pregnancy, your doctor may not want you to use those. A great example actually is Michael Jordan's wife, right? So if she is having a risk for preterm birth due to an incompetent cervix, they may not want her to use a vaginal medication because it might put her at a higher risk for infection, which could make that worse. So if she was to have a yeast infection, they may want her to take an oral medication. So like that's a great example. You need to make sure you're talking to your provider about your situation. Now, miconazole in general is safe in the second and third trimesters, but first trimester, we try to avoid it. There's not really any evidence for sure that it would cause an issue, but there's not a lot to say that it's definitively safe in the first trimester. And what we do know is miconazole is very easily absorbed through the vaginal wall during that time. So it's very likely to go through the placenta. So they basically say first trimester, see if there's anything better. But after that, it should be fine. In the case of this person with a 25-week pregnancy, we should be good. Okay. We had a question on drying up milk. How long do cabbage leaves take to help dry up breast milk? So this is a great question to which I don't actually have an answer because it depends. I hate it, guys, when I have to come on here and say stuff like it depends, because I'm sure part of the reason why you ask me these questions is because you get that answer all the time. but it depends. Okay. So cabbage leaves on their own are an extremely effective tool as part of a combination of a lot of things to help dry up your milk. They're very natural. They've been used for thousands of years, right? But a cabbage leaf is only good for about an hour or two before it has to be replaced. Basically, you chill them in the fridge and then you put them on underneath your bra. And when it gets warm and wilted, it's no longer good. And then you have to go get another one. If that's the only thing you're using, it's probably going to take the cabbage leaves a couple days to really help to dry out your milk. It's really effective as part of a group of things to help dry out your milk, which is why I urge you to check out my videos on drying out milk. But so what I would say is just keep using it. It's very safe. It's very homeopathic. A lot of people have been using Cabo cream. So I'm very, I'll never get sponsored by them. Let's put it that way. I'm kind of on Cabo cream. I know a lot of people like it. I know a lot of people have had very good success with it. But it's not natural. Okay, let's start there. It is a man-made substance where they try to basically take this chemical out of cabbage. And in order to process it so that they could sell it to you, they have to add a whole bunch of other stuff that's not being regulated. They add a whole bunch of stuff you don't even need. Remember, it's got to be a cream. They've got to sell you enough that you think it's worth the money. So they're putting in a whole bunch of stuff that's just not even going to help. And then they go ahead and they put it into plastic. So like I promise you guys, I eat at McDonald's. I drink out of plastic bottles. I'm not like uber like competitive, right? But there's a lot of stuff in our environment that's really yucky. And plastic, unfortunately, is one of them. And what happens with plastic is there's a lot of plastic that has a lot of bad chemicals in it. We all hear about BPA and I think it's BPV. I don't remember the other one, but BPA is the one everybody thinks about. And yes, a whole bunch of stuff may be BPA free, but there's other chemicals in plastic. And the thing is, the reason why these chemicals become an issue is because all these plastic things are being shipped in storage containers that are not temperature controlled. So while they're in these containers, that plastic is warming up and it's seeping into the stuff that is inside its packaging. So with Cabo cream, you're getting some of that toxins into that cream and then you're putting it on your breast. And I mean, if we think about it, why don't we like BPA, guys? BPA, amongst other things, leads to cancer. But nobody's looking at a container of Cabo cream and saying, like, is this like potentially going to lead to cancer? They don't even mention if it's BPA free. But we're putting this, which probably has BPA, directly on our breast, and then we're seeing this rise in breast cancer. Just saying. And for all of that, you could just grab a head of cabbage from the store and just use that, which is all natural. So, it's one of those things that for me, I don't know why we kind of utilize some of that stuff. There's plenty of great stuff that is man-made that's wonderful. And I know this is going to sound really weird, but I'm very pro formula. Okay. And I know breast milk's out there, but I think formula is like amazing. But that's unnecessary thing. And something like Cabo cream really isn't when you could just use cabbage. So Michael Jordan, is 10 weeks too early for the stitch? I have seen it done as early as 10 weeks. Usually they wait until 12. But to be very honest, Michael Jordan, by the time you get into your appointment, and then they decide whether they're going to do it or not, they're probably going to do a scan and they're probably going to have you do all this stuff. By the time all of those things come together, she'll be past 12 weeks anyway. So I don't think it's going to be an issue. Okay. Hi, Angie. Just experienced my first pregnancy ever at 37, which resulted in a chemical pregnancy. I am so sorry to hear that, Angie. For anybody who's not familiar, basically the simplest layman's way of putting that is that Angie unfortunately experienced a certain type of miscarriage. Okay. Doctor says should be more fertile in the next few months, but it's hard to trust since it's already been hard. Thoughts? So there's a couple of things with this, Angie. So the first thing is, believe it or not, in many ways, I do agree. Here's why I agree. There's two things that once our body does it once, it seems to remember how to do it and is able to do it oftentimes better, which is to get pregnant and to make breast milk. Okay. There's something about the body experiencing that for the first time. And it's almost like an aha moment for the body to understand the chemical and hormonal process of these things, that when it is exposed to that again, it seems to do it better. So I understand what they're saying. Now, what I will say is this: if it's already been hard to get pregnant, I would encourage you to try to find somebody who's going to take a look at you holistically. I'm in psychiatry. And so I have a lot of people coming to me with anxiety and depression, and I get a lot of patients who are experiencing infertility. Unfortunately, when you have infertility, there's a lot of anxiety and depression that goes along with that. I am into holistic medicine, and so I oftentimes order labs. And I, for some reason, order more labs than some of the IVF doctors even order. And what I have found with a lot of my moms who are going through a lot of infertility, or they're going through a lot of miscarriage, or they're actually in the IVF process, is that when I run labs, I find a lot of abnormalities. And when I have worked with some women and I correct those abnormalities in my journey to help their mood, all of a sudden they seem to get pregnant. Am I saying that I'm the one who did that? No, I think it was their body healing that helped their process. So what are some of the things that I see over and over and over again that it seems like if we correct it, they start to feel better, and then they also start to have better success? Number one, vitamin D. Vitamin D is absolutely essential, guys. I cannot say this enough. Vitamin D is something that our body needs. It is not about bones. I wish they would never say that again. Vitamin D is part of your neurotransmitters, part of how your brain functions. It's part of how your cells work. It's part of what makes your hormones, okay? So if your vitamin D level is not good, you are not going to feel good, and your body's not going to be ready to do the things that it does. So people, everybody's pretty much at risk for vitamin D deficiency at this point. But the darker your skin, the more likely you are to have vitamin D deficiency. So I'm white, obviously. And part of the reason why my skin is white is because I don't have a lot of melanin. But as you get darker and darker skin tone, that's because there's more and more melanin in the skin. And that melanin actually blocks the sun from converting in your system vitamin D. Okay. So people with darker and darker skin are more likely to have vitamin D deficiency and need to supplement. And that being said, if you guys have light skin, you still need to get it checked out, because I need to take 65,000 international units of vitamin D a week. That is a prescription strength. I have to be monitored. And for some reason, I just don't absorb vitamin D. So it is really important for you guys to understand that just because you might have light skin doesn't mean you're not going to experience this. Now, vitamin D is best absorbed using vitamin K. And a lot of people don't realize that. But guys, if you are pregnant, you cannot just take a vitamin K vitamin, okay? Because vitamin K helps with clotting, and you're already at high risk for blood clots when you're pregnant. So that has to be done under the guise of your healthcare provider. But you can eat foods high in vitamin K. Foods that are high in vitamin K don't put you at those same risks. And foods high in vitamin K include stuff like asparagus and green beans and broccoli and avocado. And these are all wonderful foods for you to eat anyway. So you can take a vitamin D supplement and you can pair it with one of these foods, and voila, you're going to get a great way to absorb that in. The second one, B12 and folic acid. These are the building blocks for your cells. These are the energy units for your cells. And if your B12 and your folic acid aren't in ideal levels, then you're potentially going to have issues with how your body functions. And when it comes to folic acid, for women who are having a lot of miscarriage or trouble, it's important that they understand whether they had the MTHFR genetic mutation. So MTHFR is a genetic mutation, sounds super scary. It's super easy to fix, where you can't process folic acid like everybody else does. So imagine if folic acid is a soft serve ice cream, but folic acid always comes with the chocolate shell over that soft serve ice cream. People who metabolize folic acid normally, they can get through the chocolate shell to get to the soft serve ice cream, right? People with the MTHFR genetic mutation can't get through that chocolate shell. So they can't ever really access the folic acid the way they should. The way to fix an MTHFR genetic mutation is you take L-methylfolate. And L-methylfolate is basically a type of folic acid that is the folic acid soft serve ice cream without the chocolate shell. Chocolate shell is just off, so you can access it immediately. For pregnant women, the recommendation is to take your regular prenatal vitamin with your regular folic acid, and people with MTHFR take that as well as the methylated folate together. The other thing is iron deficiency. So it seems like everybody just tests like a CBC, complete blood count, and they're looking at the hemoglobin, hematocrit, and red blood cells. And if those are normal, they're like, you're fine, you're good, you don't have any type of anemia. That's completely wrong, guys. That's completely 100% wrong. You can actually have iron deficiency anemia, which shows up in the back end. And the back end is actually ferritin, TIBC, and iron. And I have found so many women who their front end, their CBC is completely normal. It's like spot on beautiful. And the back end is ridiculously low. And these women need not blood transfusions, iron transfusions, because it's that bad. When your ferritin is low, your brain doesn't function, your body doesn't function, your heart races, your blood pressure can be low. It's like bad. And imagine if all that stuff isn't working, how in the world are you going to be able to sustain a pregnancy or even get pregnant to begin with? So these are some of the things that can be addressed. And if you are iron deficient anemia, you need to get that fixed. Your baby lives off your blood. If your blood isn't healthy, this is going to make it harder to maintain a pregnancy. So one of the things you can also do is look at your diet, and any foods that you eat that are high in iron, pair it with vitamin C. Okay, so if you eat steak with something that has vitamin C. And it could be just a vitamin C tablet. It could be orange juice. It could be anything. Spinach with strawberries is a great way to do spinach with iron, strawberries, vitamin C. So that's another really homeopathic way for you to get some of those nutrients. So what I would tell you is, Angie, try to see if people can get a holistic look at what's going on in your body to understand if there's other things to address. And I hope that helped other people too. So a couple other questions that I had. I had a question on, oh my gosh. There was a question on, I guess, with going with food. Is it safe to eat pineapple during pregnancy? I think I've answered this in the past, but it's cool. I'll answer it again. I'm not sure where this is all coming about. Pineapple is safe for pregnancy. They're referring to this bromelain that has been associated with like a potential for increasing like preterm birth. Bromelain is not very common in pineapple, not like what people think. And it's usually in that center core, and nobody eats that. You can eat pineapple during pregnancy. My bigger issue with pineapple, guys, is actually that it's extremely high in sugar and you don't want to end up with diabetes. Should you be eating like a pineapple every day? No. Can you eat a couple pieces of pineapple a couple days a week? Yes, it'll be fine. Okay. Everything, guys, in moderation. Okay. I had a question. Preterm labor. My cervix is 1.8 centimeters. What should I do? So cervix, this person is talking about cervical length. So remember I said a cervix should be long. So long is relative. 3 to 5 centimeters is kind of what you see. So 1.8 is like shorter, right? Unfortunately, guys, there's literally nothing we can do with a short cervix. There's nothing. There's no way to lengthen it. Some people are born with a short cervix. So this is long. Some people are actually born with a cervix that's like that. That could just be normal for you. Whatever your cervical length is, the only thing we can do is try to prevent it from getting shorter, but we cannot make it longer. So it's talking to your doctor to see if you're eligible for a cerclage, if you're even in preterm labor, but there's nothing special. It's kind of like the same thing as kind of what we've been talking about. I had a question on second trimester bleeding. I'm 25 weeks pregnant and I have brown mucus discharge when I wipe. My OB did a detailed scan and everything looks normal, but my placenta is completely covering the os. I'm on bed rest. When should I be concerned? Okay, so cervical os, OS. I don't know if anybody's heard this term, but you may end up hearing it. Cervix, this is the cervical os. So this is your uterus, this is your cervix. The cervical os is basically the opening. When they say their placenta is covering the cervix, it's a complete placenta previa, okay? If this placenta stays like this person will end up with an automatic C-section because as soon as you start to dilate, this side of the placenta is all blood vessels and you would actually end up hemorrhaging and it would be a medical emergency for both you and the baby. So somebody who's got a complete placenta previa usually ends up on bed rest. This is because we need to prevent any dilation. Even a centimeter of dilation is a medical emergency and we end up needing to give you a C-section. So we put you on bed rest trying to prevent that and then we just wait it out. Should you be concerned? You should be concerned every time you see brown bleeding. Every time you see it, you need to call your doctor. Eventually, after 2 or 3 bleeds for somebody who has a complete placenta previa, we usually bring you in and you're staying at the hospital for the rest of your pregnancy. I have actually taken care of women who've been in the hospital for 2.5 months because there was intermittent bleeding. And so we kept the mom on a monitor and made sure the baby was okay. And we just did an ultrasound every day and we just waited. We just waited and waited and waited until we couldn't wait anymore. And if we can wait 2.5 months, we will wait 2.5 months. And so this is something that you should be aware of is that eventually for some of these conditions, if you bleed enough, they'll keep you in the hospital. I had a question on, it was on my hydrosalpinx video, but it was related to IVF and it said, I'm considering hydrosalpinx sclerotherapy instead of a salpingectomy. So I'm not sure why anybody going through IVF would consider a salpingectomy. So fallopian tubes, you've got ovaries, then you've got fallopian tubes attached to the ovaries. And a hydrosalpinx is where the fallopian tube is actually enlarged. It oftentimes happens with an ectopic pregnancy. And so when that happens, we have to remove the fallopian tube because as that pregnancy grows, it becomes a medical emergency. When you are doing your tubes being tied for permanent birth control, what they're actually doing is a salpingectomy, which simply means they're taking out the fallopian tubes and then you can't get pregnant anymore. Somebody who's getting IVF, I'm not really sure where fallopian tubes would even be involved because an IVF pregnancy, the egg is fertilized externally and then implanted into the uterus. If you were doing some kind of like timed intercourse or something like that, where you're trying to stimulate a whole bunch of eggs to be released and then making sure you're having intercourse at that time, then you might want to do sclerotherapy. So for that question, I wasn't really sure, but that's what I'd say. I had a question. My baby has a sacrococcygeal teratoma. This is a type of tumor. I'm 28 weeks pregnant and returned to work. My legs and belly swell up and my in utero surgery incision site hurts. What should I do? So for this person who had surgery and is having a lot of pain and swelling since you gave birth, what you need to do is you need to call your doctor and ask them to take you out of work on a leave because you clearly need to make sure that you're resting and taking care of yourself. So that's what I would recommend you do. When you guys are having some kind of surgery, some kind of pain and swelling after surgery, that's like a really big deal. And then just make sure, I had another question where it said I'm 28 weeks pregnant. Can an infection impact like the pregnancy? And honestly, the answer is yes. You guys need to make sure you're treating any infections that you have. So thank you guys for all sticking with me. I really appreciate it. For those of you who stuck around until the end, I am going to let you know that tomorrow's video is on choosing the right OB-GYN for you. So when you're trying to pick an OB-GYN provider, I would recommend that you interview them. So this is a video that's going to tell you everything that you need to know about interviewing a provider, what to consider, what to ask, and what to think about. So I hope you check it out. My name is Dr. Samantha. I am the maternity mentor. I'm here every Monday at 9 p.m. Eastern Standard Time to answer your questions live, as well as to answer any questions that you had on the videos on the channel. Please like and subscribe. I know I sound like a broken record. I know it's weird because all of us content creators, we're constantly saying subscribe, subscribe, subscribe. Honestly, this is what keeps us going on YouTube. YouTube doesn't really support content creators who aren't gaining subscribers. So please share the channel with your friends, family, coworkers. Tell them also to subscribe. Remember, we're also on Facebook and Instagram for additional content. We really appreciate all of your support. I love talking to you guys. Please come back next Monday and talk with me again. Thank you so much for joining me. I am Dr. Samantha, the maternity mentor. Bye for now, guys.